Phenylketonuria. Symptoms of undiagnosed PKU is a smaller head than normal, epilepsy, and mental retardation. Excess phenylalanine in the skin creates a musty odor. Deficiency in tyrosine leads to lighter skin and hair. Incidence varies from race to race, highest in Turks, 1 in 10,000 births in Caucasians and East Asians. Newborn babies are screened for high levels of phenylalanine in their blood. Other blood tests are done to check if the high level is due to PKY or to a defect in another protein, BH4, that causes the same symptoms. PKU is caused by a genetic mutation that disrupts the function of the metabolic enzyme PAH, without which high levels of phenylalanine can arise in the brain. If untreated, this poisons neurons. It is a recessive disorder. Alzheimer's disease. Treatment attempts to slow the progression of Alzheimer's disease. Drugs maintain levels of neurotransmitters in the brain. People with Alzheimer's disease have amyloid plaques and neurofibrillary tangles in their brains. These consist mostly of protein and are thought to interfere with brain function and contribute to dementia that is the hallmark of AD. The symptoms can be cognitive or behavioral. Cognitive symptoms of Alzheimer's are memory loss, disorientation, confusion, and difficulty with reasoned thought. Behavioral symptoms are anxiety, hallucinations, depression, insomnia, and wandering. Over the age of 65, 10% of people have Alzheimer's. Over the age of 85, 50% have Alzheimer's. People with symptoms of Alzheimer's disease may have other causes of dementia or cognitive problems, which may be eliminated, but a certain diagnosis can only be made upon direct examination of the brain for tangles and plaques at autopsy. Alzheimer's disease is characterized by progressive destruction and death of nerve cells in the brain. This leads to shrinkage or atrophy in certain regions of the brain and a decrease in neurotransmitters. Sickle cell disease. A bone marrow transplant is the only cure. Adults tend to reject the transplant. Hydroxyurea drug prevents or lessens sickle cell's complications. Blood transfusions and narcotics for pain also help to alleviate the symptoms. Sickle cell disease is common particularly where mosquito-borne malaria is common. It is believed that people who carry only one sickle cell mutation can tolerate malaria better than people who do not carry any mutations. This may be why the mutation persists in the population despite the high mortality associated with untreated sickle cell disease. Pain associated with blocked vessels can lead to hospitalization. The blocked blood vessels frequently lead to spleen, lung, and heart damage and stroke. Most common single disorder in African Americans. A child with sickle cell anemia makes hemoglobin S instead of hemoglobin A. Sickle cell anemia is one type of sickle cell disease. Sickle cell disease is caused by a mutation in the blood protein beta-globin. The mutation leads to changes in the shape and behavior of red blood cells. The sickled, stiff, and sticky red blood cells of sickle cell disease cause severe organ damage and intense pain.